If you can just provide us a quick update on the status of just COVID-19 here in San Benito County.
So we continue to have a more or less level incidence. It's been decreasing over the last weeks and months since the COVID-19 variant surge and around Delta. And presently, we continue to be declining less rapidly, leveling off, as most of or many places throughout the country are actually increasing at this time. So we're doing relatively well.
And just looking at the graph from last week, there was a small spike at the end of October. Do you know what we can attribute to that?
Well, these are typically cases that may be related to each other. There may be community spread around a group of individuals that, given that our population is not that large, even a handful of individuals on a curve like that can create what looks to be like an impressive bump, but it's actually just a handful of individuals. And that was the case in this instance.
Okay. And then also just looking at the data, most reported cases are within the 25 to 49 age population. But
yes,
the hospitalizations and deaths are, individuals 50 years or older. What is the vaccination rate for that population?
For which age group?
50 and older.
I have to get you today's number to be precise, but overall, we've been, prior to the addition of the 5 to 11 children, which expanded our denominator and just pulled down our percentage rate of those who have received vaccination, as is to be expected. Prior to that, they were around where we are generally as a county, in the high 60s, 70%. I'd have to look at each specific age stratum. There are some that we need to have improvement on. I believe that those middle-aged adults and young adults are an area where we could see some uptick, and we'd like to push more uptake of the vaccine, as well as in adolescents.
The biggest gap in the makeup of the county's population and vaccination rate still remains the Latinos. What is the reason for this, and what is the county doing to address this issue?
Well, that's not actually correct. The level or rate of overall vaccination of our Latinx community is on par with the rest of the community. Early on in the pandemic, early on in the vaccination effort, we saw a significant differential between Latinx community and the balance of the community, which is, as you know, of course, a historical inequity we have in U.S. healthcare and public health. And we, as a public health team, moved very aggressively to try to close that gap, and we have been successful in doing so. So much so, as again, I haven't looked at the data today, but as of recent weeks, we actually attained in some age groups better uptake of vaccine among the Latinx majority of our community than among the rest of it.
What is your view of people's feelings of boosters? Are they getting boosters? And if so, are they switching the vaccines, or are they typically staying with what they initially got?
We are, as the rest of California, and now the country as a whole, recommending that everyone who received their first doses and whatever vaccine they received will get now the booster. This will have a significant positive impact on their immunity and better able them to resist any severe consequences should they be infected, such as hospitalization or, of course, death. So we are seeing a strong response to that. People are attending public health clinics and the pharmacy clinics, getting their booster shots. We're happy to see that. We'd like to see everyone ultimately who has been vaccinated previously get their booster shot. As to which one, we don't track, I don't have an analysis for you to report, something we'd have to look into. I'm not sure we would have all of the data on which vaccine they're choosing for their third, but the bottom line is it doesn't really matter. If you pick the same vaccine that you had previously, as I did, for example, I was first vaccinated with the Pfizer vaccine, and I had my booster dose with Pfizer, and it dramatically improved my immunity. And that's going to be the case for everyone. Or if you switch to Moderna or another one, you're giving your immune system a slightly different flavor, a different kind of charge, if you will, to improve their immunity against this virus. So it's less important which vaccine they get for a booster than they get that vaccine and do it, frankly, as quickly as possible. We're heading into the Thanksgiving and Christmas holidays. This is a time where, as you know, of course, people celebrate family gatherings, social gatherings. This represents a real opportunity for this virus to get at those individuals who remain completely unvaccinated in our community, and to cause breakthrough infections potentially in those who have not received the booster. So public health is very strongly urging all members of our community to get that booster dose. And I would really ask that they do it as quickly as possible before these holidays.
And speaking of the holidays, what recommendations do you have for those families who plan on celebrating?
Well, we firstly wish all of our residents from public health a very joyous Thanksgiving with their family members. We note that this is the best Thanksgiving we've had since the outbreak began 2 years ago. And our recommendations are that if you're having a family event, and you know everyone there has been vaccinated and preferably had the booster, it's not essential that they mask. So you can have a normal, truly normal Thanksgiving and Christmas, but with that big proviso, because even if there's one individual or a few individuals who have not vaccinated or not completed their vaccination schedule for all those doses, they are at real risk. Because, as you know, those who are vaccinated, vaccination doesn't prevent you from having your nasopharynx, the area of the nose and the throat, can be potentially habited by this virus without causing you sickness yourself, because that's what the vaccine does. It protects that virus that may be in your nose from infecting your lungs, then through your blood, the rest of your body. But because it exists or colonizes our nose and throat areas, you can be an individual that gives that virus, transmits it to an individual who is unprotected because they are unvaccinated. So our recommendations for the holiday is have a wonderful holiday, enjoy your families again in person. And if everyone is vaccinated fully, there is not a need to mask during those celebrations. But if you go to parties where it's going to be, if you will, a mixed group, where there are going to be individuals, or you just don't know individuals' vaccination status, there we strongly recommend that you continue to mask in any social congregation where you are not very certain that everyone has been vaccinated, because it not only puts at risk those individuals who are not vaccinated, but if you get colonized and then you go back to your families and someone who may even be vaccinated get a breakthrough infection. The breakthrough infections among the vaccinated have generally been very mild. But why go through that, particularly when we're expecting a possibly intense year with influenza? We really want to protect people as much as possible during this period. So enjoy to the fullest, as normally as you wish, if everyone's vaccinated. If not, don't take the chance, mask.
Now, some residents might use home tests before they gather with family. How accurate are these home tests?
They're generally quite accurate, and so that is not an unreasonable strategy to pursue. They are not bulletproof. The blood sampling testing is more accurate, but the home tests are, if you want to check your status, that it's not a bad idea to do that. But again, if you're going somewhere where you know everyone in your family, and particularly the elderly members of the family, older parents, grandparents, aunts, uncles, which we all want to see, of course, at Thanksgiving and Christmas holidays. There, if there's anyone there who could be vulnerable or who has one of the existing diseases that places you at higher risk, I would recommend then that home test be taken. It certainly can't hurt to have information. Information is always empowering.
Yeah, and for those residents that can't quite afford a home test, where can they get tested here in the county? Is it free still?
It is still free, and the testing capabilities, if you just go on, if they go online to public health, all of the information is there with contact numbers where they can find where they can get tests. Of course, they can get tested with their physicians if they have a physician that they can access readily. And then there are several opportunities throughout the county for testing that are all listed on our website at San Benito County Health and Human Services Agency.